Hello and welcome to this week's What Were They Thinking? Much of this week's news is about the CCP virus, whether that's lessons on statistics, news about the vaccines, both those for the CCP virus and influenza, and more. You can find timestamps for each news item in the description box below. Let's begin with this particular infographic, or perhaps picture might be a more accurate word for it. It's supposed to be from the Financial Times and shows the time series for both case count of CCP virus and the time at which vaccinations began. The claim is that this shows vaccines work. In part, this is possibly true given the way the vaccines have been rolled out. What it doesn't make account for is the variations before vaccines were issued and exactly what the timing is for vaccinations. It is the old adage of correlation does not equal causation, and in this case, many of the troughs following the peaks are more closely associated with lockdowns of one kind or another, particularly the United Kingdom statistics. The American states themselves have also instituted various lockdowns that have coincided roughly with the same events. Therefore, this graph may be mixing its correlation and causation based on a very simplistic model of what is happening. At least looking at places like the United Kingdom, they've begun rolling out vaccines for the elderly and frontline healthcare workers first. This may be having an impact given that the virus spreads more readily amongst the elderly and has a higher mortality rate. Frontline healthcare workers could also be a very efficient point of contact for spreading the disease. As a result, until restrictions are lifted, it's hard to tell whether or not the numbers we're seeing here are a result of lockdowns or vaccinations. While speaking of the United Kingdom, the United States of America, the United Kingdom variant, or the UK variant of the CCP virus, is doubling its case count every 10 days at the moment. This is a very disturbing figure. When it was first reported, it made up less than 0.5% of the total case count in America. It's now up to 2%. It's looking like it'll reach 4% in about 10 days. That is how much more infectious this variant is compared to the original. A doubling of case counts would be in line with what other countries have had once they were infected. The UK variant has become the dominant strain in each of these countries. America has time yet, as it is still not the majority of infections, but if the spread continues the way it is, by March it will be everywhere and it will practically be the only strain infecting people, until yet another even more infectious mutation occurs. Considering what we've just said about the spread in America, news coming from Australia should be no surprise whatsoever. One of their states, Victoria, has just entered a hard lockdown where there are only 4 reasons to leave your home, these being shopping for essential groceries, giving care, essential workers, and education. All of these with the exception that you can only do so if you can't do so at home. They're also allowed to leave their home for 2 hours per day to exercise. People must wear masks everywhere. If you are going to leave your home, you can't travel more than 5 kilometers away. One of the reasons for this aggressive lockdown is that one of the infections, or several of them, are the UK variant, and Australia, having been able to largely avoid the bulk of the impact by the CCP virus due to a strong-handed but very effective control of the virus, doesn't want to continue to have to enter into a long-term lockdown, as other countries like America, UK, and parts of Europe have had to. This is further complicated by what appears to be Victoria's flawed, or at least strained, quarantine system which uses a private hotel to accommodate people, a less than desirable facility for an infectious disease like this. Despite that, as we've said, Australia has largely controlled the outbreak. Like other countries, Australia has also been fortunate enough to have access to a vaccine, in fact several. The problem appears to be that at least some of these vaccines are proving less effective against some of these variants. Of particular and notable concern is the Astra Zeneca and Oxford University vaccine. The vaccine, at least in the context of this particular CCP virus variant, appears to have diminished effectiveness on mild and moderate symptoms, but it does seem to avoid some of the most severe symptoms. This means it will prevent some of the most drastic needs, such as those that would lead to hospitalization, but it won't prevent some of the less severe symptoms that would make your life difficult. In the context of all things, this is still a ultimately winning outcome, but certainly not a desirable outcome. When you look at the possibilities that would occur without the most serious symptoms being controlled, we have what you see in America, the medical system overloaded by people who need oxygen, respirators, and more. If you could cut down the number of severe cases, you could free up hospital beds and provide the necessary healthcare to those who need it most, and you don't have to start triaging and trying to decide who does and does not get treatment based on the available facilities. This may be happening in America before long. Parts of America, such as California, are already experiencing strain in their medical system in some counties, such as LA County. This might get a whole lot worse before long. The first reason for this is that the Superbowl occurred recently, and the Superbowl occurred in Florida, where there were 25,000 fans. 25,000 fans who may have been infected by the CCP virus. The stadium was packed to approximately a third of its total capacity. On top of this, of the 25,000 fans that were there, 7,500 were vaccinated healthcare workers. The remainder have little to no data on at all. They weren't required to be vaccinated, and they weren't required to be tested. That means a very large percentage of those 25,000 people could have been carriers and infected others. Combine this with intoxication from drinking, and people begin to make mistakes, ignore rules, guidelines, and good PPE practice, ultimately making very bad decisions. Much like drinking and driving, except in this case it's drinking and carrying a deadly disease. Then there is their behavior that's simply part and parcel of being a fan. Yelling, crying, waving, being extremely expressive. All of these actions can produce respiratory droplets. Respiratory droplets that, even if you follow the 1.5 meter guidelines, still may carry across to other participants, the probability of which only rises the longer you're in the proximity of someone else, or in this case, 24,999 others, a large percentage of which may well have been carriers. This whole situation is further compounded by the fact that Florida is one of the states with an unusually high representation of the UK variant of the CCP virus in their statistics. Where most of the country has it around 2%, or at least that's the average, Florida has it at 4.5%. That means these 25,000 people could have been in an environment where not only were they at risk of infection from the CCP virus, but one of the more infectious strains out there. When looking at this at the very local level of the Superbowl itself, you can see a problem. We now need to look at what happens at the local level, but across the entire country with Superbowl parties. That is, how many of these events, indoor events for the most part, could have been the source of an initial infection that just spread out quickly from one small party. Whilst yes, everybody needs time to relax and recuperate, especially given the stressful environment everybody lives in at present. Many people opted to celebrate at home rather than going into the Superbowl itself. However, some people still ran them, and this is a problem. Before the Superbowl, up to a quarter of Americans had planned to attend a Superbowl party to watch the game, or more likely to watch the adverts. That is a disconcerting number, and roughly in line with other events in America, such as Memorial Day, the 4th of July, and Thanksgiving. If this is going to follow the same general trend as those events had, we should see a jump in infections after the Super Bowl. The same conditions apply to the Super Bowl parties as to the game itself. Fans who are energetic, yelling, producing a lot of respiratory droplets in a confined space with long-term exposure. And chances are, depending on where you are in America, you carry one of the more infectious strains, if it's not the original, and this means the chances of infecting others are significantly higher. That means the Super Bowl could be a catalyst for yet another surge, a significantly larger surge than we have seen so far. This comes on the fact that America is trying to distribute a vaccine. Different states have had different degrees of success, but overall there is a rising effort to get vaccines out there and into people. In one particularly notable story that came out this week, there were people with vaccine trying to transport it to a hospital. The idea was to administer doses. The problem was they were caught out by a snowstorm. The snowstorm led to them being held up due to a car accident. Problem is, vaccines need to be stored at very cold temperatures. Cold temperatures that can't be maintained even in a snowstorm. What do you then do with a dose of vaccine that can't get to where it's needed, but will go to waste if it's not used? That's when the team decided to set up a makeshift vaccination clinic where they used the doses that were available to vaccinate people. They did this simply by going door to door at each car and offering the vaccine to anyone in the vehicle. It took them 45 minutes to administer the 6 vaccine doses that they had available. It took a lot of car knocking to find people who would accept it, with most people declining, albeit politely, but still declining. This is in a country where nearly 500,000 people have died due to the CCP virus. Millions more have been infected. Despite this, it took healthcare workers the better part of an hour to find recipients for 6 doses. This is an outrageous number, even when considering that they would have to complete paperwork and similar while they go through the process of doing so. This is not the only issue with the CCP virus. We've mentioned repeatedly that it has many symptoms. Some are short-term, others are much longer term. One of these symptoms, neurological symptoms at that, is the colloquially called brain fog. That is the persistent difficulty in thinking clearly, both during infection and afterwards. It's often associated with fatigue, memory loss, and confusion. This persists after you have recovered from the CCP virus. That means the virus itself is not the direct cause of these symptoms. What they found by looking at the cerebrospinal fluid was that there was a raft of inflammation markers in the cerebrospinal fluid. This means that the symptoms were likely continuing to be caused by some sort of inflammation or inflammation byproduct in the brain. The upside to this discovery, as preliminary as it is, would indicate that the prescription or administration of anti-inflammatory medication might help to mitigate the effect of brain fog. This means that patients can be treated and hopefully, after subduing the immune system's activity, can return to a relatively normal life with full brain function uninfected by long-term symptoms of the CCP virus. Speaking of long-term symptoms, the concern has been, what if children get infected? And yes, there is the ongoing meme of, won't somebody think of the children? And whilst yes, again, it is true that children are unlikely to be impacted as far as symptoms go, and they are very efficient spreaders of the CCP virus, there's also cases of them having extremely severe symptoms. Ways around this are not exactly clear, particularly since they can't get the standard CCP vaccine at this stage. It hasn't been cleared for prescription to children, or pregnant women for that matter. What is interesting coming out of a recent study is that it would appear, at least in children, that one of the influenza vaccines appears to reduce the risk of severe symptoms from the CCP virus. This distinction is important. It's been clearly established that the influenza vaccine in an adult will not protect you from the CCP virus, but if it might protect children, the influenza vaccine is approved for them. That means there might be ways to at least reduce the number of severe cases of CCP virus in children by using an accepted and approved vaccine. We already know from past research that exposure to certain coronaviruses could reduce the chances of you getting severe infection. We had nothing clear about whether or not children could be so protected. The idea behind this is that the influenza virus is another coronavirus. This data comes from a relatively small cohort from one hospital, the Arkansas Children's Hospital. It involved 905 patients, all of whom were under 20 years. They were trying to figure out whether or not being vaccinated for the flu and pneumococcal diseases had an impact. What they found was that if you had the influenza vaccine, then you had a significantly lower chance of severe cases. The same results could be found when they accounted for pneumococcal diseases, which were also vaccinated against. There were also a reduction in respiratory symptoms if you had the pneumococcal vaccine. The researchers admit that they're not talking drastic reductions in anything here, but they are looking at shaving off a few percentage points with each vaccine that lowers the risk. And this is a case of making what you can out of the smallest things possible, trying to save as much as you can before you have the proper cure for it and minimizing the risk of harm. This is yet another way that, at least in theory, more hospital beds can be made available for those who desperately need them. As we've mentioned already, some counties simply have no available beds because they're all being taken up by severe cases of the CCP virus. If you have a finite number of hospital beds, and you have to dedicate so many of them to the CCP virus, even a small reduction in the percentage prevalence of severe cases could free up a large number of beds at the population level. This reduces the strain and stress on the health system. This in turn means staff get more reprieve, hospitals can provide better care, and the hospital system can cope better overall. That's the same argument behind flattening the curve. The only difference between the two is that flattening the curve was something being done on a policy basis, versus this being part of simple standard medical care in getting people vaccinated. And it shows that vaccines can do more than just treat for the disease they're meant to treat for, but provide protections that aren't necessarily notable until something like this comes up. Still talking about the CCP virus and America, we also want to talk about the decision in New York about allowing people to dine indoors. In the lead up to Valentine's Day, the governor of New York, Cuomo, has stated that they would allow indoor dining. Since this is Valentine's Day and perhaps one of the busiest nights in most of New York, this makes sense from a business perspective. It keeps people employed, gives businesses making a profit, and could also be a very effective vector by which to spread the CCP virus. One of these things is not like the others. The question that we're raising was also raised at a briefing about this, and it was asked quite simply, why are you vaccinating various groups, but not those who are working in restaurants and delivering food if they're about to become one of the major points by which disease could be spread? Governor Cuomo said, we can't do this because we'd have to remove people who are already listed to receive the vaccine. A short time later, they then reversed that position, in a manner of speaking, and instead said that they would delegate the decision to regional health departments. This, of course, doesn't answer the question, particularly considering that these people, workers in particular, work their entire shift. People come in, they dine, they leave. They could pick up the CCP virus in that process. The staff, since they are there for far longer, are at much higher risk. In turn, people exposed to workers could then become infected. If they don't become infected, when these people return home, their immediate family, those they have immediate interaction with, could become infected. And you can see how these things begin to balloon very quickly. This decision is even more controversial for a number of other reasons. First, this is the middle of winter. People aren't going to want to dine outdoors, so indoor dining or takeaway are the only options. The fact that the governor has decided to approve indoor dining could be another landmine in the making, similar to past decisions related to the issue of the elderly in aged care facilities. New York has had some of the worst mortality rates in aged care facilities due to the CCP virus in all of America. This owes to a number of policy decisions made throughout the highest points of infection. This means that this could be yet another policy decision that leads to outbreak, and since New York is already struggling in controlling the spread, creating a catalyst like this could be incredibly bad. On the balance of that, you need to account for the fact that these businesses have been trying to balance all of the rules that vary almost daily. Some of them are more extreme than others. This has led to them struggling financially, employees being let off, businesses folding, simply struggling to make ends meet, and now they're being offered a lifeline of sorts. It's unlikely many of them will let it go, though this does put their staff and the public at risk. The last time something similar was attempted was back in September. The decision ran between September and December. In that time, infections went from approximately 300 up to 3,300. An 11-fold growth. Such a drastic increase in just 3 months inevitably led to that decision being reversed. The current decision is being made when the daily infection figure is 5,500 and some, significantly higher than it was at the peak of the growth after the last reopening. If we see a similar growth, we could expect there to be 55 to 60,000 new infections every day. Yeah. You can see why this decision is controversial. In other controversial news, Facebook is banning more CCP virus anti-vaxxers. Controversial in terms of they're throwing up a fuss and claiming persecution. And whilst, yes, we largely believe free speech should be a thing, we also believe there should be repercussions for making dumb statements. In this case, both Facebook and Instagram have started banning people after claims of misleading information. This is incredibly powerful and useful, given that many of the anti-vaxxers are targeting the CCP virus vaccine. Facebook has gone to the effort of expanding the scope, so it no longer only focuses on misinformation about the CCP virus and vaccine, but instead now targets all anti-vaxxer claims. The various claims they're looking at is that the CCP virus is man-made, that vaccines are ineffective, it's safer to get the disease than a vaccine, or that vaccines cause autism. This, of course, is largely Facebook simply cleaning up its own mess. Studies have clearly been able to demonstrate that, for the most part, Facebook and other social media have been massive drivers of fake news and conspiracy theories. This means the very problem Facebook is now trying to address is the problem they themselves have made, often by creating echo chambers. This, in conjunction with the current close oversight by the US government, means that social media, but Facebook in particular, may want to take very careful steps in just how they go about doing this, as it may turn around and bite them in the arse hard very soon. The final news item we have this week regards a treatment, but thankfully this news item is not for the CCP virus. It's a weight loss drug that could be effective. considering just how much of the developed world is obese, and even the developing world is overweight, verging on obese. It's not a pretty number. In America, it's over 40%. Places like Canada, Europe, Australia, all are in a similar position. Even countries with historically healthy populations, such as Japan, have also seen a similar explosion in weight gain. This is obviously a combination of factors, both socio-cultural and diet-related. In many cases, people deal with this via extremely invasive surgeries, lap bands and such. These, of course, carry their own risks and aren't always effective, especially if you ignore the proper procedures afterwards. That's where this new drug, or at least new application of an existing drug, comes in. It's called semaglutide, and it is used in the treatment of type 2 diabetes. When used as a diet suppressant, the trial results are impressive. The trial ran over 68 weeks and involved a control and experimental arm, your standard clinical trial format. Those who were in the control group lost some weight, but nothing of any remark. Those who were on the semaglutide lost 14.9% of their body weight, and a significant portion of the study group lost more than 20%. That is a very big figure. When you consider that this was done in combination with diet and lifestyle guidance, you can see why this could be a very appealing option for weight loss. Of course, any treatment like this is not going to be without side effects, and unfortunately, this drug is not suitable for treatment as it stands. Nearly 60% of the participants in the experimental arm had to discontinue treatment due to the severity and regularity of their side effects. This compares with just 5 in the placebo group. The other caveat to this is that it requires weekly injections. Obviously, most medications used at home are based on a pill or tablet. Oral medications are far easier to administer, but that's not possible with this, and so, much like diabetes medications, it could require training, storage, and other difficulties that make it a less desirable drug to use for its purpose. There's also issues to do with what happens after you cease treatment, and at least one individual who was on the clinical trial reports to the New York Times that they continued to regain their weight after the trial had ceased. This means they're on their way back to gaining weight and becoming obese. That's an issue, particularly if the training and guidance did not take. The simple reality is that for the most part, body weight gain is a factor of energy in, energy out. If the energy in exceeds the amount of energy going out, you will gain weight. This is why many foods that are readily available in America and other countries are calorie rich, but aren't particularly good for you. This leads to the massive ballooning obese population in many developed countries. This has carry-on effects, particularly notable ones where it comes to cardiovascular disease, diabetes, and more. All of these can drastically reduce someone's quality of life and lead to an untimely death. If it is possible that a treatment like this, in conjunction with education and facilitation, could lead to a reduction in the number of obese people, we could see a reduction in the number of people needing support, acute presentation to emergency departments with something like heart attack or stroke, and ultimately improved quality of life for many people who at the moment don't exactly have that option given their weight. The clinical trial results as they are now aren't enough to get approval, but it is possible, after assessment, refinement and modification, and even as is, it might be accepted as a drug, particularly in America where the FDA is analyzing it. But it's also being examined in the United Kingdom and Europe. And that's all the news we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.